said moments ago, more people have now died from COVID-19 in our area, including a veteran who was being cared for in a veteran's home in Salisbury.
But tonight, there are some questions about how his case was handled and if others were needlessly exposed. He is now among more than 46 people who've died in North Carolina and 2 in Rowan County. The state has 3,200 cases so far, and 354 people are in the hospital. That is up from 270 just yesterday. Channel 9's Mark Becker is live for us tonight in Salisbury. Mark, you've been in touch with the people familiar with this case, and you're told that after the man left the hospital, he was returned to that veteran's home and even allowed to go near a roommate.
Yeah, that's what we're hearing, Erica. Despite all of the screening you see outside of the VA facility here at Salisbury, to simply get in, you've got to stop at a number of checkpoints, starting with that one right there, manned by Salisbury police. There are tents along the way where you have to answer a series of questions. The Veterans Home is a separate operation here, but everyone does go through that same protocol, which is why this case raises so many concerns.
The Veterans Home confirmed this morning that the resident died Saturday, and test results confirmed he had coronavirus. But that was several days after, sources tell us, he'd been allowed back into this facility with symptoms that raised concerns. Here's the timeline. On March 27th, sources say that patient in his 60s was allowed to leave to attend a family funeral. He got sick and last Tuesday was taken to a hospital in Winston-Salem, where he was diagnosed with advanced stages of lung cancer. On Wednesday, he came back to the Veterans Home and was put in with a roommate, even though he had a fever and a cough. On Thursday, he was put in isolation. On Friday, he was tested for COVID-19. He died early Saturday morning, and on Sunday, test results showed he had the virus.
So when we typically get positive test results, our communicable disease nurses then start investigations.
Nina Oliver, Rowan County's health director, told us they were notified of that positive test late yesterday and are now trying to track whom that patient had contact with here and at that funeral he'd attended.
That's one of the steps we would find out through our investigation and figure out what to do next with those people at the funeral.
Sources tell us 3 other residents were tested. One of them has since died of unrelated causes, while the 2 others, including his roommate, are still in quarantine.
And the parent company for the Veterans Home here did send us a statement this morning about this case, saying, in part, the Salisbury facility continues to operate at an alert code red status and has been strictly following enhanced infectious disease protocols, including increasing cleaning frequency, postponing communal activities, ceasing visitation, screening staff and patients daily. But they did not want to comment on that timeline or why that patient was allowed back in here and put in a room with at least one other person. Erica?
And that timeline shows just how quickly it led to his death. We send our prayers to his family. Thank you, Mark.